Ladies and gentlemen, thank you for joining us this afternoon. I'm David Morgan. I work in the communications office for the New Mexico Department of Health. I want to thank all of you for coming this afternoon, especially on short notice, so we could be able to provide an opportunity to be able to talk with city county lawmakers, health providers, and of course the general public about the COVID-19 coronavirus. With me today are our Deputy Cabinet Secretary, Eric Chenet, and to his right, our State Epidemiologist, Dr. Michael Landon. Just real quick, I do want to thank the City of Las Cruces for providing this venue for us to be able to talk to you at, and thank them also as well for being able to stream this live on their YouTube channel and be able to provide this video for the public who is unable to attend today, so they are able to hear this as well. So without further ado, I'm going to let the experts do the talking. Here is Deputy Secretary Eric Chenet.
Thank you very much, David, and good afternoon, Las Cruces. Well, number one, why did DOH decide to come down and talk to you face to face? We want to make sure that our local partners and that the local community is fully engaged and is fully prepared for and understands the situation in the state of New Mexico right now. We want people to stay as healthy as possible, and so that's why we're getting out here. Not much has really changed in the current situation, but we want to make sure you are fully informed. New Mexico has not yet had a patient with the novel coronavirus that causes COVID-19. We are currently working to identify cases as early as possible and implement isolation procedures to prevent further spread of the virus should we have a case. COVID-19 causes a mild illness in roughly 81% of those who get the disease. Typical symptoms are fever, cough, and shortness of breath. The most heavily impacted and vulnerable populations are those who are older and those who have some other sort of illness. Only about 2% of those who are getting sick with COVID-19 are children. Most recently, we've experienced increased cases of person-to-person spread on the West Coast. Globally, China has had the greatest number of cases, but now case growth is most significant outside of China. The department is also working with the healthcare system to ensure the availability of beds and personal protective equipment should the need arise in the state of New Mexico. The Office of the Secretary and the Epidemiology Division, which is Mike's area, have conducted or soon to conduct a large number of calls and webinars with employers groups, elected officials, legislators, hospitals and provider groups, universities, child care organizations, school district superintendents, and many other groups to make sure that everybody's fully informed and understands where we're at each step of the way as we go through and are managing this. The Department of Health has been releasing press releases at least weekly, is communicating with other state agencies by providing guidance and other materials, is working to translate these materials into multiple languages, and launched a website dedicated to keeping people up to date with the state's response. And you can get to that website and look at updates as they come in on the nmhealth.org website. That's all I have for now, and I'm going to pass it over to Dr. Landon for further comment. Thank you.
Well, good afternoon, and thanks for the opportunity to be here. This is great. My first job with Department of Health was district epidemiologist here in Las Cruces. So I like coming back. Thank you. Thanks. Deputy Secretary Chenier gave you an overview of what we're talking about today, and I'll go into a little more detail about several things. Focus on a little more about the virus itself, the situation globally and the U.S. What's a pandemic and why might that be significant? I'll also talk about the current, sort of our current activities, what we're currently doing as a state, and what we are planning with respect to the possibility of community spread of this virus. So our planning efforts, should we have community spread in the state. So the virus is, this is a new virus. People haven't been exposed to it before. And that's why we call it novel coronavirus. And it is in a family of viruses. So you have the common cold, which is a very mild, very typically provides a mild illness. And, sometimes people now will get a lab test back, which will say coronavirus. And that means the seasonal common cold virus. So that's on the mild side. On the more severe side, we have SARS, and you may have heard about SARS. That's severe acute respiratory syndrome. And that emerged in 2002, somewhat similar to what's going on with this novel coronavirus, which causes the COVID-19 disease. And so that emerged in China, and there ended up about 7,000 or 8,000 cases. And then it fizzled out in April. That one did not cause as much disease and death. This new novel coronavirus is already causing more cases and more deaths. And numerous people predict what's going to happen, but it's really hard to predict what's going to happen with a new virus. So we have a new virus, and as Deputy Secretary Chenier said, it is more likely to affect older persons and persons with chronic medical conditions. And it has a very low infection rate among children. Only about 2%, as Deputy Secretary Chenier said, 2% of the cases are among children, which is different from influenza. And a lot of our planning around how to deal with a new virus is around influenza. So that sort of changes the calculation. We know that there are about a little over 90,000 cases globally, a little more than 3,000 deaths, and there are now 76 countries, or 77 including China, 77 countries that have cases. And the biggest developments have been, first the emergence in China, and then 2 weekends ago, we really started to see a lot of transmission in a couple of additional countries, in South Korea, in Italy, and in Iran. So all 4 of those countries have level 3 travel restrictions. So you're basically just it's recommended not to travel there. And in the U.S., we are starting to see more cases diffusely and also particularly on the West Coast. There are, I pulled the latest off the CDC website today, and it's about 99 total cases, and the majority of those are travel related. And then there are a number that are, of the ones we have determined whether they're travel-related or person-to-person spread, and then we have an increasing number that are person-to-person spread. And on the West Coast, in particular, Washington State and California have the most cases. and they currently each have over 30 cases. And then we have a number of other states that have just recently had cases, and they have between 1 and 5 cases. States around us, Arizona had a travel-related case over a month ago, and Texas just diagnosed a travel-related case yesterday. That one's not even in the CDC numbers yet. So depending on what numbers you look at, New York Times is saying 18 states, but somewhere between 15 and 18 states have cases right now. So a pandemic is what there's particular concern about, which is a new virus which can cause infections in people. That's number one, new virus causing infections in people. Number two, it can spread between people. And then number three, that spread persists, it's sustainable, and basically sets up in communities. That third one is what the World Health Organization, which makes the determination about whether or not we have a pandemic, is evaluating right now. Because the first two have been easily met. The question is, how widespread is the virus widespread enough to call it a pandemic virus? So the term pandemic causes fear, but it really just signifies there's a new virus, and it's now spread throughout the globe and causing infections. We did have a pandemic in 2009 with an influenza virus, and that initially was thought to be more severe than it was. We're currently, most of the influenza in the country right now is caused by that same virus. We've gotten immune to that virus, immunity's built up, we have a vaccine, and it's here, but it's more routine. It's not this new virus that all the attention is being directed toward. So New Mexico has been preparing for a while for this. And the pandemic exercises, pandemic preparedness, getting ready for the possibility of community spread in a community, is something we've been working on for a long time, ever since 2009, and we have a lot of tools that we've developed since 2009. Since then, we had the Ebola virus, and people were concerned about Ebola virus being imported into the United States. And we developed we did traveler monitoring at that time if there was a traveler from the region in Africa with Ebola, we would learn about that through airport screening, and we'd touch base with that traveler and make sure that they weren't symptomatic and they knew what to do if they got sick. So a lot of the things we've developed over time, so we have tools that have been in place. Our public health system is really designed to help in situations like this. Sometimes you don't know public health's around. We have an excellent regional public health system here in Las Cruces, centered here in Las Cruces, and local public health offices. You have that support here in the community, and they've been doing work on disease control for a long time. They know how to do it. They know how to do disease investigations and those sorts of things. So we have the tools to deal with this. We also we're a centralized state health department. So in many states, and most states don't have this, you'll have a municipal health department, you'll have all these county health departments, and you have a state health department, and they have to coordinate across all those health departments. We have basically just one big system of a public health system in the state, and that allows for more efficient investigation and communication between the different levels of the health department. I mentioned, with respect to Ebola, I mentioned the traveler monitoring. So when we started to see the cases in the U.S. From China, just before, there were, it was set up so that there would be airport screening of travelers from China. That information would be communicated with the state health departments, and then we would reach out to those travelers who came back within the past in the preceding 14 days, and we would touch base with them, make sure they understood the symptoms of the novel coronavirus, and that we would talk to them about checking your temperature twice a day, and then they would report the temperature to us, and also if they had any symptoms. And we've been doing this for about a month. We've added the 3 additional countries with level 3 travel advisories to that. And this is a routine system established during Ebola and recommended by CDC. And all states have been doing some degree of this in the country. And New Mexico does this too. Therefore, that way we're able to focus on persons who have had high-risk exposure, and we've been able to work with them so they understand the possible disease and what to do if they get sick. So that's been a very important part of this. And that's all voluntary. It's not, we're not, nobody's, it's all a voluntary thing that we work out with those travelers. We've been working with the healthcare system to make sure we're prepared. And we do a weekly check-in with the hospitals to see what the bed availability is. How many pediatric beds, how many adult beds, how many intensive care unit beds, that sort of thing. And we do that routinely during the influenza season. And we really sort of started it, before the last pandemic, but it sort of became perfected during the last pandemic in 2009. That system is already in place, and we are going to continue that should we have, we're going to continue it until the coronavirus dies down. We also check in with hospitals on a weekly basis to see if they have enough personal protective equipment. You may have heard in the news about the run on masks and gowns and those sorts of things. We have a system where we check in with the hospitals every week and keep track of that. And that's something that we could have done before, but we really just sort of geared it up recently to make sure that hospitals and other parts of the healthcare system have adequate personal protective equipment. We've also been working with the hospitals and clinics to make sure they understand, and they do, how to evaluate a patient with novel coronavirus, how to get that patient tested if needed, and how to basically provide education to those patients. So the healthcare system being prepared is very important. We've also, you all may have heard about lab testing for the novel coronavirus. So that became available to state health departments last week, and we did our first test at the end of last week. And we continue to do those tests, and the tests are now more available. There are early indications that some of the national commercial labs, as early as next week, will be able to do coronavirus testing, novel coronavirus testing. And so that's a really important development because it'll make testing available. Testing will be more available, and it will be more routinely done. Just like if you went to your doctor and needed a lab test, then it would be done in a sort of a similar fashion. We are doing lab testing in an expanded fashion for sort of 3 situations. If a traveler gets sick with fever, cough, and or shortness of breath, we consider lab testing in that situation. One of those, the traveler from those 4 countries that I mentioned, South Korea, China, Italy, and Iran. If someone has an unexplained pneumonia and had to be hospitalized for it, and there was no specific diagnosis for that pneumonia, we would consider lab testing for that. That allows us to look at some of the possibility of infection in persons with severe illness. And the travel is not required for testing in that criteria. The third criteria is the criteria to sort of look for the possibility of mild illness. So there we're basically, for some patients who have fever and cough, influenza-like illness symptoms, and a negative influenza test, we'll consider testing in those situations. So we're able to get at sort of many different levels of disease and exposure by that approach. And the amount of testing in the state is increasing. We also have been doing lots of webinars and communication. We had a sort of City of Albuquerque did a sort of similar meeting, but it wasn't open. It wasn't open to the public like this one. We're visiting with you all here, and then we're going to go tomorrow to Roswell and Clovis for similar presentations. We've also been meeting with hospitals, conference calls with hospitals, tribal leaders, school nurses, child care centers, child care providers, and we're continuing to work with the lists because we have many additional partners to discuss this evolving situation with. So that's what we're doing. That's what we're doing currently. So what are we doing to prepare for the possibility of community spread of this new virus? One of the key things is to make sure that our message is clear and that people understand what they should do in the event of community spread. So that messaging is quite important. And one of the key things is to make sure that people are cared for in the best setting for their illness. So the illness is going to be of different severity. People will have different levels of severity of illness. And we know that about 80% or maybe even over 80% of the illness is mild. So the best place for someone with mild illness to take care of themselves will be to take care of themselves at home. That way, that's best for the community, and as long as they do not have conditions that will make them at greater risk of infection, greater risk of complications, such as older age and chronic medical conditions such as other heart disease and respiratory disease, then it's best for somebody to receive their care at home. But we know with a new virus, there may be, if we have community spread, there would be greater pressure on the healthcare system. So we have to be prepared for that possibility, and having people go to the right place for their care is very important. So we'll have a sort of a coronavirus line where people can call, and we'll have clinical advice at that line and then additional advice. And so people can work with, say, a nurse, discuss the case with a nurse, and then we can make recommendations about the best place for that person to receive care. So that line that's going to be very important so that we get people getting their care in the right place. We also realize that, even during influenza season, hospitals get full. So we have to have options for if there is a lot of patients attempting to get care at the same time. So we've worked with hospitals and healthcare systems to have what are called alternate care sites. These would be sites that provide additional, we would have additional outpatient rooms, additional inpatient beds for hospitalization, and they might be at that same facility or they might be at a different building. So we have plans and we're planning with hospitals and healthcare systems to do that. We don't have a vaccine. This is a new virus. It takes a while to develop a vaccine. We don't have a vaccine for the virus yet. It's estimated that it will take between 12 months and 18 months to develop a vaccine or to have a vaccine available. We also don't have antiviral medication like we do for influenza. I mean, we do have antiviral medication. It just doesn't help a lot with this virus. But there are studies to look for additional antiviral medications to treat this. But we don't really have that right now. So social distancing is going to be very important. So what is social distancing? Well, it's basically the concept that if more people are together, there'll be more transmission. And if people are spread apart, there'll be less transmission. So there's been discussion about potential considerations of closing schools, of canceling mass gatherings, and also encouraging people to telework. I mean, technology is really developing, and we can do a lot of things by phone, internet, that we couldn't do before. I mean, you could have a meeting at work where you don't get together. You just do a conference call for your meeting at work. So we could do more of that if we have community spread. So those are possible options on the table to look at. Now, do you remember when I said only 2% of the cases were among kids or children? So this is children basically 18 and under. They only 2% of the cases. So we did a lot of planning around the possibility of an influenza pandemic, where the assumption is we would have lots of cases among children. And in that instance, closing schools might be, a clearer intervention. In this instance, it's a little less clear, and we're benefiting from others' experience about to what degree has closing schools been helpful in those settings. And so that's information that we continue to follow. We want to make the best science-based decisions we can about these interventions. And unfortunately, Washington State in particular is going through a big outbreak of novel coronavirus, but we're learning from them. We also have the opportunity to really track the virus well if it becomes more widespread. New Mexico is one of 13 states that works with CDC for sort of advanced influenza surveillance. Influenza is a respiratory illness. We can basically continue using that system, but shift it over for novel coronavirus. So we're in the process of planning for that. That allows us to track the illness more carefully, allows us to track severity more carefully, and allows us to be part of this 13-state network that's providing that will provide the data for the whole country. So that's very important. And that public health surveillance is something that public health does routinely. We just aren't that aware of it. We'll become more aware of it should community spread develop. I think with a new virus, it's mysterious, it's very scary. However, I mentioned to you how H1N was a new virus in 2009, and now it's our routine seasonal virus. That doesn't mean it wasn't scary at the time, but the fact that a virus is new and can cause infection in a lot of people, that can be very, very scary. But we've done a lot of planning for this, and I think we're ready as a state to address this challenge should we have community spread. What can you do? So we're still in respiratory illness season. The same interventions that are helpful for influenza, except that we don't have the vaccination, are helpful for novel coronavirus. So washing your hands regularly, covering your cough, not going to work if you're sick or school, those are very important. And high-touch surfaces can be wiped down with a household cleaner, regularly. That's a good idea too. So those things are in our control, and we can do those, and they are helpful. It's also important that we work together as communities, should we have community spread, to assure that the entire community is protected and that we work together to reduce disease. And that's sort of the role of public health, and that can be the role of all of us. So that's really important. So I really want to thank you for coming today and for your attention. And now I think we're ready for questions and answers. So let's see. David.
Pardon me here, everybody. Hi. So if you have a question, by all means, raise your hand. I will be coming around, and somebody else will be coming around on the other side, for that side of the room.
Thank you for being here. We appreciate it. As you may know, we are going to have the Baton Death March on March 15th. Over 9,000 people are anticipated on being here from all over the world. What can we do as participants as well as volunteers just to protect ourselves in this matter? I did reach out to White Sands, and they did tell me that there are no plans to cancel the march right now, and they are closely monitoring and tracking the situation. So that's what they're at right now, which is great. But what can we do as a community?
Yeah, thank you for that question. And we started discussing this yesterday. Now, we are prepared, but we just heard about this one yesterday. So it's very important to address this. And when is the March 15th? It starts the Thursday before, because that's when the
packet. Next Thursday, a week from today, is when we start picking up our packets, and that's going to be at the convention center here. Okay. So you're talking over 9,000 people. Convention center gets very, very busy. They'll be picking up packets Thursday, Friday, Saturday, and the march is at White Sands on Sunday.
Right. So we have not diagnosed a case of novel coronavirus in New Mexico. As long as that holds, the main issue will be travelers from countries, the high-risk countries. So we're collaborating with the organizers on some communication to those travelers. So that's one thing. And the other thing will depend, and then what to do with that large number of people coming together will depend on if we have novel coronavirus or not, and we don't have it in the state right now. So yeah, thank you for the question. We're working with the organizers on the planning to address that, and you're right, that is something we need to consider how best to work with the event. Thank you.
Okay, we have a question back here.
Good afternoon, Doctor. I'm with a local cleaning company, and we specialize in healthcare, working in the healthcare sector. Is there a way, should there be an exposure, that we should decontaminate specifically, or to eliminate the risk of further exposure or spread?
This virus, it's different from other viruses. All these viruses are different. but you really don't need to use any special approaches to cleaning other than what you'd use for influenza or other viruses. So the standard approach to cleaning healthcare facilities, other facilities, works well. So no additional precautions are needed in terms of the cleaning.
Okay, is there going to be a fee for anybody that needs to be tested? And what about quarantine and everything? Are they going to be charged, a fee? How is it going to be covered?
Yeah, so for the cost of this, and we have been discussing this, right now we have the lab test available. We had hundreds of the tests, and by next week it'll be commercially available, we hope, starting next week through the national labs. For testing at the state public health lab, there's no cost to run that test. The provision of health care for novel coronavirus is really not going to be funded any differently, though, than the provision of health care for influenza. So it would be basically similar to what we're doing now. If for people that don't have insurance, relying on indigent funds, relying on hospitals to provide that care, and they are required to provide the emergency care. With respect to quarantine, we are, as I mentioned with the traveler monitor discussion, we're taking basically we're emphasizing the voluntary approach. So we'll be looking toward people to stay in their home for the quarantine. And if we have to come up with alternative arrangements, we'll work on that. But in general, we would be working on arrangements where people could do that in their home. Okay?
Very good question, ma'am. Thank you very much. We have another question right here for you, Dr. Landon.
Thank you for coming. If one were to suspect that they had coronavirus, which I understand is a dry cough and a temperature, where would that person go to get tested?
So right now, the vast majority of people, the vast majority of people in the country with those symptoms would be having influenza. But in certain places like Washington State and California, there would be increased concern that those symptoms might be suggestive of novel coronavirus. In New Mexico, we would recommend that if people were going to go to the doctor because their symptoms were severe enough, go to the doctor like you normally go. And if you should be tested for coronavirus, that'll be worked out with Department of Health for this week, and hopefully starting next week and the week after, it'll be more incorporated into the routine lab testing. So you would basically just go to your regular healthcare provider, but we really are we're in the mode of of looking for coronavirus in the state, and we need to continue to look for it. But right now, we have not diagnosed any coronavirus in the state. Thanks.
Thank you for coming. My name is Renee, and I work for a senior community that houses 130 residents, about the average age of 80. And I heard you mention that you were working with different entities to get them prepared, and I just wondered how I could get my community on your list.
So is your community an assisted living facility, or?
We are an independent retirement community that allows aging in place, allowing those professionals to come in and offer assisted living to our residents as they need it.
Right. So I think the thing to do, and I'm sort of, steering this toward our local health department here and our regional health department here in Las Cruces. But I think we could schedule basically a meeting with you all and explore how you guys can be best prepared in your community.
And I can confirm that, yes, we can arrange that. Just find me here after the event.
I sure will. I had a second question real quick. I just wanted to confirm the amount of time it takes once tested to get your results, because I know that there were some pending cases in Juarez that I don't believe we've had word on. So I just wondered how long it took to get the results as well.
So at the state scientific lab, which is in Albuquerque, if someone was tested in Las Cruces, we would transport the specimen up to Albuquerque, and then basically every day, essentially if it arrives in the morning, it would be run that same day, and results would be available, either that evening or the next day.
All right, thank you for that. We've got another question right over here.
Thank you. We are getting some very good information here today. How about the Spanish-speaking people? How are you providing that information to them?
Good question. We have translated a number of our materials into Spanish, also Chinese, Vietnamese. We need to translate them also into Navajo, those sorts of things. We could do more outreach in Spanish, and we probably should be thinking about that. That's very important, and we need to make sure this information gets out in multiple languages to all people. We've also been thinking about, we put stuff up on our website, and we, expect most people to be able to access it there, but not all people can. So we're working with local governments to think of other ways, maybe some more old-fashioned ways of distributing, like a one-pager about what to worry about, how to be prepared, that sort of thing. Yeah, thanks.
My name is Lori Mendelson. I'm a disability and human rights activist. And in many counties and states across the country, there are emergency plans for people with disabilities and the elderly. And I think it's great to work it out with one assisted or independent living organization, but that's not enough. So how will you get the word out to people with disabilities who may not have access to computers, or who might, to people who are elderly, of which there are many here, since this is a great retirement community, and also to the schools for children, our most vulnerable populations? The other thing is, I understand that dogs can get coronavirus, and I'm wondering what we do to protect them and ourselves. Thank you.
Okay, thank you. So we have, the Department of Health has a number of different focuses, and one of them we have the Developmentally Disabled Services Division. And so that division works with the developmentally disabled population, and we're working through our division at Department of Health to get the word out to their clients. So that's one mechanism. For the older adult population, we're working with a fellow State Department Aging and Long-Term Services Division to get the information out. So, and we're also working with all our local public health offices to get the information out locally in the community. So we're not just trying one size fits all approach. We're trying to approach this on many different levels. And for dogs or pets, specifically dogs, there is guidance about how to protect your dog. So that's available on the CDC website. Sure, thank you.
Thank you very much for that, ma'am. Dr. Landon, another question right here.
Yeah, hi, I'm Dr. Judy Bowles, and I'm the medical director at the Campus Health Center at New Mexico State. God bless you. I've already had to call you 4 times in consultation this week, and you've been really helpful. I have a multi-part question. We're a very international community. Our people are coming and going, and people are traveling all over the world. Do we quarantine people until the test results come back once we've got our negative influenza or negative strep? What if home is a dorm? And my third part of the question is, you said you're working with organizations to provide PPE. What if we start running short? We've not been able to order from our regular medical suppliers.
Okay. So, great questions. In terms of okay, so let me work my way from the last question. So, if you have trouble with PPE, I would start with calling the Las Cruces health office. There's a preparedness planner there who can make the connection statewide. We also have what are called healthcare coalitions. These are regional groupings of hospitals and other healthcare organizations that actually share resources, including PPE. But Department of Health is tracking, and when an entity has less than 7 days supply, we work with them to get additional PPE, either help them with ordering it or get the sharing to happen through the Healthcare Coalition. And we also may need to implement conservation measures for PPE, which are, CDC has recently developed those materials to do that. So there are a lot of tools, but I would say talk to the Las Cruces Public Health Office, connect with them, and then we'll work on a problem-solving approach. So that's for personal protective equipment. The other question is basically if you have somebody who is exposed, or you think is exposed to novel coronavirus, and you want to get them you want to test them, and then what do you do while you're waiting for the test results? A lot of the testing now, we haven't had many tests that we've done for folks in the high-risk group because we haven't had to. So the high-risk group are those people traveling from those 4 countries that develop symptoms of coronavirus, and that's really the highest risk group. Another would be say a healthcare provider exposed to somebody with coronavirus, but we don't have any coronavirus in the States, so we don't have that situation. So the key thing there is if there's a really high-risk situation, you'll be working with us on testing them, and we'll also work with you on how to approach basically potentially having that person stay at home by themselves until we get those test results.
If home is a dorm?
If it's a dorm, we'll have to work out an alternative. We'll probably have to work out an alternative arrangement. But there are different options. Healthcare facility versus another type of facility. But those are great questions. And the third part was about the international community. Could you repeat that one?
No, I was just saying we are a very international community.
Very, very good.
We also have students out there studying abroad, and we have 28 right at present, 4 in South Korea, and you guys have been great in helping our travel office to decide who to bring home and who not to. So
great.
I feel like we're a little teeny bit higher risk than regular because of our comings and goings.
Right.
But you guys have been great. Thank you.
Well, and thank you for all that preparedness work that you all are doing, because you can see that NMSU is prepared and getting ready for the possibility of more spread.
Hi. My name is Mary Lou. I'm the supervisor for animal control for Doñana County. My question to you is in regards to the animal control officers who are in the line of duty. In regards to the already preparedness recommendations that you are asking on an everyday basis, what can I take back to the officers in regards to the additional recommendations for being prepared as a possible exposure for officers that are, of course, in the homes and into picking up animals and into areas that are possibly exposures on an everyday basis?
So that's a great question. We would emphasize the basic respiratory illness prevention measures that would be taken during the routine influenza season. So and since we don't have any coronavirus diagnosed in New Mexico, that's what we would recommend right now. Should we have, say, for your officers in this area, should we have community spread, then we would recommend, we would follow the recommendations for law enforcement officers probably, which is basically if they can stay 6 feet away from the individual when they're talking to them, we'd recommend that. And then if they do need to get closer to someone for a prolonged period of time, then we would recommend that they, if they're working with somebody who might be sick, then we'd recommend that they would call EMS at that point to deal with the sick person. But for their usual duties, they can probably do their business if we have community spread by just making sure they stay, 6 feet away when they're talking to the person they're dealing with with their animal. Thank you.
All right. Thank you, everyone, because these are really great questions. We do have to wrap this up at about 3 o'clock, so we really only have time for a couple of more questions. Dr. Landon, I have one more here for you.
My name is Isaac. I'm a nurse that works with New Mexico Family Services. And as I've been hearing some of the comments or questions, a lot of it that I've been hearing is how can we help those people that are in locations where they don't have care. We do have the capability of seeing patients via telehealth, sending an MA or an RN depending on what the need is, and we'll see the doctor via telemedicine, and we can also do the testing for the flu and the strep to go ahead and rule that out. If anybody is interested, we can just send somebody to a location such as the disability centers, as you were talking about, just putting that out there.
That's fantastic, and emphasizing the fact that we can provide a number of these services without, being 6 feet away from other people. I mean, you can't provide all services, but some of them you can. And the telehealth piece, I'm glad you emphasized that. Increasingly, managed care organizations in the state have telehealth available. And that's a great, something new that we didn't have really during the 2009 pandemic, and something that could be really helpful. Thanks.
Okay, another question right over here.
I have a couple of questions. One is, how many tests have been performed in New Mexico to date?
The governor at her press conference yesterday, where she was signing some health bills, where she emphasized the importance of being prepared and not to panic about this. She let people know that there were 2 as of yesterday, and since that time there have been additional tests, and we are going to be putting that number up on our website on a regular basis, but that number's, I don't know the exact number today, because there's testing going on right now.
10, 20, how many?
I would say at this point, not knowing exactly, over 10.
Okay, the other question I have is, as you may know, we're rapidly approaching basketball conference championships season, and a couple of the WAC teams have announced that they're not going to Seattle. And I'm wondering, are we, since we've have the foreign travel advisories, do you have any in-country travel advisories?
There are no in-country travel advisories at this time.
As a real practical matter, I have a routine doctor's appointment in a couple of weeks, and I don't like to go in any case for any reason. But in your experience, if I weren't running out of a prescription, I wouldn't even go. But in your experience, if you looked at other places, how often are they finding this out? They're testing the person at a doctor's office, and if they're a suspected case, then if they didn't know yet, then you've got all these people exposed, including the person doing the lab work and that kind of thing. And I just wondered what the experience about those issues have been in other places.
Yes, I mean, the contact investigations for people that have been in contact with somebody with coronavirus are very extensive. And yeah, in other places, we haven't had to do this in the state because we haven't diagnosed a case yet, but in other states, they've done a lot of work with that, and they have improved approaches to that. Those contact investigations are done somewhat routinely around other infectious diseases. If we have a measles exposure, that sort of thing. So those are very well formulated. Public health is very familiar with how to do them well, and we'll also be learning from other states that have been doing those investigations around actual cases. Thanks.
Hi, my name is Lourdes Torres. I'm also with New Mexico Family Services, and I would like to address, her concern, and that was part of, a second, approach. We are, in order for us to stop the spread, we have mobile doc available. So instead of you going to the office, you're able to log into your phone and connect directly with our doctors. So that helps out with the dorm situation to where they don't have to leave the room. We're able to ship your medication directly to your home, and that would help stop the spread as well.
That's an excellent point, and yeah, thank you for that. These alternatives to seeing somebody, in the same room face to face, have expanded, and we will need to take advantage of those if we have community spread. So, on behalf of Deputy Secretary Chenier and myself and Secretary Kunkel, who had planned to be here but had to stay in Santa Fe, we really thank you for coming today. We thank you for all your efforts to be prepared for the possibility of spread in the community, and really thank you for your excellent questions today and your participation in educating others in the community who couldn't be here today. So thank you very much.
Ladies and gentlemen, I just want to add to his thanks to all of you, again to the City of Las Cruces, and to the television audience out there that will be watching this on the City of Las Cruces YouTube channel. Ladies and gentlemen, just know that if you need any further information about the COVID-19, you can go to our website, nmhealth.org. That is nmhealth.org, and you will find on the upper right corner of the page a button that will take you directly to our COVID-19 page. Thank you very much.